Hey guys, welcome back to my YouTube channel, The BDS Graduate. Today I am discussing in detail about the functional matrix theory. It comes under the subject of orthodontics for the final year students. Okay, so this theory it was given by Melvin Moss, and he said that the bone and the cartilage growth it is not self-directed. Okay, the growth and the maintenance of all the skeletal tissues these are always secondary to the certain responses which are occur in the adjacent non-skeletal tissues. So the growth of the skeletal tissues these are occur due to the some responses which are occurring in the non-skeletal tissues. So according to this theory it is divided into two types, the functional cranial component into two types. One is skeletal unit, another one is non-skeletal unit or the functional matrix. So this non-skeletal unit subjects it includes the periosteal matrix and then capsular matrix. In the skeletal units it is divided into macroskeletal and then microskeletal. In the periosteal matrix it acts directly and actively on the microskeleton. So this is microskeleton, so this is a non-skeletal, right? This non-skeletal responses because of this response on the microskeleton unit. And the capsular matrix it act indirectly and passively. It act directly and actively, it act indirectly and passively on the which one? Macroskeleton. So the periosteal matrix act on the microskeleton and then capsular matrix act on the macroskeleton. So here the actions are occurring. Because of this it brings the sum of a changes, like it brings about the active and compensatory transformation. Here transformation means the change in the shape and the size according to the bone movement. These are occurring in case of a periosteal matrices. In case of capsular matrices, it brings about the passive and the translation change. It means there is no change in its shape according to the bone movement. So the difference between these two is here finally it leads to the changing of the shape and the size of this structure. Here there is no change in the shape. Coming to this, the periosteal means surrounding, right? So the example muscles, glands, nerves, blood vessels, etc. Here the capsular matrix, main capsules comes under the neurocranial capsule and the orofacial capsule. And in case of the skeletal units it is divided into macro and then micro, right? Macro means it is entire one component, like maxilla, mandible and neurocranium, these are one component. And in case of micro means the parts of this one. So mandibular parts like angle of mandible, condyle, coronoid and then mental. And coming to this maxillary components like palatal, orbital and then pneumatic. So this is a functional matrix theory. The main concept of the theory is the skeletal tissues growth which is occurring due to the response of this non-skeletal units. So this is a non-skeletal units and this is a skeletal units. Thank you for watching. Please do subscribe my channel.